Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. Welcome to this week's episode of Medically Speaking. My guests today are Mike Hersey, who is the director of the Sports Performance Center here at Southern Maine Healthcare, and Ricky Soroy, who is the manager. Gentlemen, thanks for being here.
Thank you very much for having us today.
Thanks for having us today, Robert.
So let's talk a little bit in generalities. Mike, let's start with you. The concept. How did you two come up with the concept for the Sports Performance Center?
So this is something probably about 8 years ago. Rick and I started to look at the current state of healthcare and the way that it was going with insurance reimbursement and the lack of visits for formal physical therapy post-surgery. So about 8 years ago, Rick and I started talking about developing a program where kids could come in for physical therapy, but then transition to a certified strength and conditioning specialist athletic trainer to be able to continue. So insurance companies will typically take people until they can go up and down stairs, walk, get around, get in and out of bed. But that's not what athletes do. Athletes jump, athletes cut, athletes move quickly, they're explosive. And so what we decided was this would be a good way to offer a full line of services in this area.
Now, Ricky, from the athletic training side, you work with a lot of athletes and you work with folks who aren't athletes. In fact, maybe that's my question. Who do you work with at the Sports Performance Center, and what kind of care do you give them?
Yeah, I think we work with a wider range of athletic individuals, and I think we use the term more physically active because that entails obviously our very successful athletes at the high school, college level, and middle school levels. But it also includes the weekend warriors who, they're not necessarily playing in formal competition several times a week, but they are very active on the weekends and doing different types of events, whether that's 5Ks, 10Ks. Spartan races, Tough Mudders, things like that. But our approach is quite a bit different. I think the great thing about us is everything is individualized. So everything starts with our initial assessment. So with my athletic training background, it's really easy for me to do a joint-by-joint ortho scan as well as a fundamental movement screen. So we look at, physically putting our hands on our clients and determining, are there any restrictions, limitations, are there potentially some issues that may pop up in their training that may be an injury risk. Then we obviously, do stuff where we're standing, moving, looking at patterns of movement to see if there is anything that are red flags, anything that changes from them being on the table, from, progressing to a standing position. And then we build a program based off that assessment. Obviously, each person is different. Some are post-op, some are not injured. We have I would say probably 80 to 85%, of our clientele are not broken, so to speak. They are active, healthy, reasonably so. But even with those people, we're looking for potentials that may pop up down the road and account for those through their training. So I think the biggest thing for us, looking at our approach as being much different, is it's an individualized program approach where we're able to assess certain things that the average Joe can't, and then make the appropriate adjustments.
So it sounds like the approach you take it's a combination of physical therapy and athletic training. How did you two get involved in this? What were your backgrounds, and why the focus on the sports training?
Yeah, I think personally for me, being an athlete growing up, I wanted to find a career that was somehow tied to, involved with athletics. So when I was in college, I selected to be an athletic training major. And essentially, most people think of athletic training as the acute management. Sort of, if you're, just for example, if you're watching, an NFL football game, somebody's hurt, the first people running out are athletic trainers to care for that athlete, assess the injury, and make a return to play status. So I did that for quite some time, being on the front line, so to speak. And then, I think as time went, I wanted to change my approach. I wanted to be somebody who would help prevent those types of encounters. So not being the person that picks up the pieces, but the person that helps the pieces from being broken initially. So it started with just a couple of people, developing programs for assessing, making some changes, and then just kind of grew from there. So I'm an athletic trainer as well as a certified strength and conditioning specialist, and a couple of other certifications as well that help in our background. But it's been about 15 years now that been involved in the field post-graduation. So yeah, it's been great. Very fortunate.
And Mike, how about you? Where did your interest come from on the sports side of things?
I would say, like most of our staff at the Sports Performance Center, actually all of our staff at the Sports Performance Center at least played high school athletics. And over 90% of our staff at the Sports Performance Center played college athletics. We have a bunch of Division III athletes that work for us. And I think myself, just like the rest of them, we wanted to work with healthy individuals and also post-injury individuals and get them back on the field. Being a college athlete, one of the worst things that you could do is miss games. Even Division III level games are important, and you love to play. For myself, I found growing up, sports were a huge part of my life, allowed me better time management skills throughout college, and I just like to help kids see what I was able to see through athletics. Similar to the rest of our staff at the Sports Performance Center. I've been doing this now 19 years, and throughout that 19 years, I've been very fortunate to be able to work with athletic population. In 2000, I was able to work with the United States ski and snowboard team, and I did that for 12 years, was able to go to the Olympics in 2006 and work with the U.S. snowboard team in Torino, Italy, and also be the first physical therapist ever named to the sports medicine team for the United States Olympic Committee. So like I said, athletics, working with athletes has always kind of gone hand in hand for me, and I just like to carry that on as I go through my career.
Now, when you're describing the Sports Performance Center to patients or clients, do they ask you the difference between going to regular physical therapy versus the Sports Performance Center? We know that you integrate medical physical therapy and training specialists. Is that unique in our area?
I would say that unique is a great word to use to describe the experience when people come to see us at the Sports Performance Center. It's a different type of physical therapy than what you may receive elsewhere within the state of Maine. It's a very active approach. Most of our clients that come in enjoy. It's a friendly atmosphere, and we have a lot of patients and clients actually respond to the different type of atmosphere. It doesn't feel like a medical building when you walk into the Sports Performance Center. It feels like a place where it's friendly and people can have a good time while they're going through a tough situation.
So I think if I could just add to, or build off of what Mike initially talked about, is I think our environment is quite a bit different. I mean, it's a very active environment, but it's a family feel environment. I think that's one thing that we've always prided ourselves on. We take a vested interest in all of our clients and patients to get them back to whatever they're trying to get back to. It may be as simple as just being able to go up and down stairs, yes, but or it's getting back on, the basketball court or the football field or field hockey field. We're trying to get them back as quickly as possible, as safely as possible. And there's a sense of urgency, I think, with the care that you get with us that may be different than some of the other models that are out there. We're trying to push the envelope, use the latest research and techniques to get them back as quickly as we can.
So how do you partner with SMHC Orthopedics and Sports Medicine? How does that partnership work?
So we work daily with our physicians over at Southern Maine Healthcare Orthopedics and Sports Medicine, whether it be on sideline coverage, whether it be direct referrals, post-surgical patient care, non-surgical patient care. Every day is a little bit different. Every day we're either talking on the phone with them or we're talking through the computer with them just to make sure that every patient and client gets the best care they can receive. If we have clients that walk in off the street and they were hurt the night before at a basketball game, we can pick up the phone and we know directly we can get those patients in immediately for a visit with one of our orthopedic surgeons or sports medicine physicians.
And I think the other thing, that's great about this relationship is that there's just a lot of trust back and forth. I think, the physicians trust us to do our job, and they know that we're providing the best care and the best interest of their patients in mind. But the same can be said when we refer our clients and patients to them. We know that they're getting the best care that's available to them.
How do patients access your care? There are different levels of insurance coverage, et cetera. How does that work?
So one of the best parts about working for Southern Maine Healthcare is that we take every insurance. So if somebody has surgery or somebody is hurt and they're referred by their physician to the Sports Performance Center, We don't have to worry about what the insurance is. We take all. So that's one of the nice things on the physical therapy side. Most of the physical therapy is either through word of mouth or a direct referral from an orthopedic surgeon or primary care physician, or sometimes the neurology department over at Southern Maine Healthcare as well. On the training side, I think that a lot of our patients are referred either by their coaching staff, the athletic trainers that we have employed at the schools, or through word of mouth just from friends that they have currently training at the facility that have had a great experience with us.
Now, if a listener is hearing this and they're thinking, well, this sounds interesting. I'm a 45-year-old guy and I still like to pick up basketball. I'd like to extend my career a little bit. What do you say to that so-called weekend warrior about what your program has to offer? And what's the current thinking about keeping that athletic career going in your later years?
Yeah, I mean, I think probably the biggest thing relating to that is a lot of people struggle with volume, intensity, duration, what exactly to do as they start to get a little bit older in their athletic careers. I think being able to modify, adapt, change your current thinking of what you've done when you're in your 20s in the gym is going to be a little bit different than what you do in your 40s and 50s in the gym, just from having a little bit more mileage on the tires, so to speak, as we get a little bit older. So, I mean, I think that's where we kind of come in. We're able to provide some solid education advice, programming to keep them going, in a healthy state rather than them on their own going to the gym and doing things that potentially put them at an injury risk or cause an injury that sets them back from being able to do what they really do. So I think we're a great sounding board. We're able to be a good conscience for the person and just monitor their overall intensity and volume of their programs and giving them exercises that they would never think of doing, on their own, of course, that take in a multiplanar approach, a more functional approach rather than sitting in machines that you typically would see at your box gym.
Now, what sort of ages are you seeing in your clientele who, they're involved in all kinds of sports for school? What kind of ages are you dealing with?
So from ages, geez, it really spans the spectrum. I've worked with kids as young as 8, and then, adults as old as 87. I can think of one really active 83-year-old that's still playing a bunch of tennis, comes back every summer and trains in the facility just to keep moving forward with his tennis career. But I would say that the majority of our clientele is sort of that middle school, high school, college age athlete. We've been really fortunate to work with a lot of very successful athletes in the area that have moved on, to play Division 1, 2, 3 athletics, which working with that population is great. It's very rewarding, but at the same time, I think our facility is unique where we're able to work with all spans of abilities, and I think we get just as much satisfaction and and a sense of accomplishment with the athlete who makes a varsity team for the first time or makes a team for the first time after coming and working with us a little bit and getting some advice and some training and things like that. So I think we do a great job working with all abilities. This is not just elite level athletes. It's everyone who's looking to maximize their abilities.
You're listening to Medically Speaking. We're talking today with Mike Hersey and Ricky Soroy from the Sports Performance Center at Southern Maine Healthcare. And we'll be right back with more of our discussion coming up right after this.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with our guests, Mike Hersey and Ricky Soroy from the Sports Performance Center. Now, you talked about working with schools. What sort of programs do you offer, and how do you get involved with these schools?
We currently provide athletic training services to Thornton Academy, Biddeford High School, Biddeford Middle School, Old Orchard Beach High School and Middle School, as well as Sanford High School and Middle School. So between those 4 communities, we're able to offer athletic training services. So athletes that are hurt on the court or hurt on the field are able to go see our athletic trainers directly in the athletic training room after school, as well as they provide game coverage for every athletic event at those schools. So we really feel that we have those schools very well covered and we're providing the best care possible. The other thing that we started a little while ago is offering a free summer program similar to what Ricky was talking about earlier with the injury prevention piece, we offer a free 6-week program currently in Saco as well as down in Sanford for any athlete that wants to come and train with us for twice a week for 6 weeks during the summer. It's been very well attended over the past few years. Offering it in Sanford this year was excellent. The feedback from the coaches was amazing. So once again, being able to offer something for free for injury prevention for these athletes, especially during the summer, get them up out of bed, get them moving, get them active, has really been a positive thing for the Sports Performance Center.
No, one of the hot button issues of the day, of course, in sports is the concussion problem. How do you at the Sports Performance Center deal with concussions, preventing them and treating them?
So I'd say the Sports Performance Center is doing an excellent job, leading edge research, following the current data that is out there. So all of our high school athletes are impact tested, sort of neurocognitive baseline tests. So if they do sustain a concussion while they're on the field, we're not putting them at risk to sustain another concussion. And we're also doing the best possible job that we can to get them back on the field as safely and as quickly as possible. The other thing that we've worked a lot on over the last few years is getting them back to academics as soon as possible. So it's a full spectrum that we're able to offer. The other thing that the Sports Performance Center is now able to offer, and one of the few places in Maine, is a impact pediatric test, which now kids as young as 6 can come in and be baseline tested. We do those baseline tests annually on those student athletes, and it just gives us data if we were able to have a athlete injured and have a concussion or a suspected concussion, they can come into the facility and we can make sure that they're managed correctly.
Now, you've obviously worked with a lot of student athletes over the years. Is there a particular story of recovery that kind of sticks out in your mind that we might want to hear about?
Yeah, I think we've been really fortunate to work with a lot of gifted athletes over the years, and just thinking back, there's been several that have kind of gone through the full spectrum. So some that have been hurt. I can think of one who was hurt on a football field, traumatic shoulder injury, ended up having pretty significant surgical intervention to fix the issue, and was Gatorade Player of the Year and won numerous awards, and is a scholarship football player as well, and has since returned to the football field and is doing great. I can think of another local female basketball athlete who we had trained quite a bit, had sort of a freak accident at a volleyball practice, actually, ended up having a surgical intervention, went through the formal physical therapy process, back to the training process, and is now receiving several scholarship offers on the basketball front, and probably one of the handful of best female basketball players in the state. So there's been numerous success stories, kids who obviously haven't been injured and have had a ton of athletic success, but several too that have gone through the full spectrum of our services that we're very proud of all of them, of course.
Now, for the athlete that you just described who had the shoulder injury, how do you integrate the physical therapy with the athletic training to get that person back on the field?
So it's pretty nice. The athlete was able to be referred to Dr. Johnson, and Dr. Johnson was able to perform the surgery on this athlete. We were able to immediately get him in post-surgery for physical therapy, able to start very simple physical therapy initially. Unfortunately, athletes still need time to heal. They can't just have surgery and immediately get back on the field, so we still have to take that slow initially. And then about 6 weeks in, Rick was able to start working his lower body, which was a big deal for this athlete. We also were able to, at about 12 to 14 weeks, get him back into the sports performance side and be able to start his upper body lifting as well, and make sure that he was doing things safely to protect his repair, as well be able to get him ready to be back on the football field as soon as possible safely.
So this is a real integration of services between surgery, physical therapy, and athletic training. Is that fair to say?
Absolutely, and that's what makes us so unique, is we're able to offer everything within one facility. We've had people ask us before, would it be better to separate the physical therapy and this training side? And the answer to that, both Rick and I both have said numerous times, no. This is a full model, from orthopedic surgery to the athletic trainers that are on the field seeing these athletes initially injured, to being able to go to physical therapy, to be able to finish their training sessions with a licensed athletic trainer as well as certified strength and conditioning specialists. It's that full model that's what makes this work.
Now, it sounds like to me that you're not just training athletes and rehabbing injuries, you're also trying to prevent injuries. Maybe talk a little bit about how you do prevent injuries. I assume that starts with the athletic training side. Maybe talk a little bit about that.
Yeah, I think unfortunately we can't prevent all injury. Anytime you play a sport, you assume a risk, and what we try to do is put the athlete, the person, in the best position to reduce the risk. So obviously, looking at our individual assessment pieces we alluded to earlier creates that framework for allowing us to put together a really well-rounded program and address things that typically wouldn't be addressed at a normal gym setting. We're a very functional movement, multi-planar, progressive facility that puts together programs that sort of hit all aspects. And then, of course, whittling things down to specifics to what sport that they're playing at that current time to address any of the specific, requirements or concerns of that sport. So I think we do have athletes get injured. It does happen, particularly on the football field. It's a collision sport. Bodies hitting each other. Bodies aren't meant to hit each other like they do on a football field. So, obviously people do get hurt, but, trying to put them in the best position possible to reduce the risk.
Now, what would you say to the parent listening to this broadcast about, let's say they have a child who's interested in getting into sports. What would you say to them about the participation in sports and how they can protect their child?
Yeah, initially I would say play as many sports as you can. As a young athlete, I think, being well-rounded is very important. So specializing at an early age, we know the research is not there to support that. Chances are that little Johnny or Jane is not going to be a scholarship athlete. It's few and far between, particularly in this area. So I think playing as many sports as you can, being as diverse as you can, really it also does help in reducing the risk of injury. Using muscles and joints in different patterns and physical demands of different sports is very important. I would say for us, when people start in our facility, it really depends on what they're looking for. I said earlier that we kind of start with ages that are as young as 8, but really middle school, high school is kind of where we see the majority of our clientele start. And I think that's when we're able to add a lot of pieces to the puzzle for them. I think initially when they're real young, going out and playing with their friends and playing as many sports as they can is very important. And then, we would never discourage a kid from playing a sport to train in our facility. So we look to supplement their sports participation, I think, which is very important to, keep kids as active as they possibly can be.
Now, does it have to be about sports? Can someone get involved in the program who's not involved in sports?
No, they definitely do not have to be involved in a sport. I think some of our most satisfying and success stories are kids who come for different reasons. So whether it's someone who is a little bit overweight or somebody who lacks a little bit of self-confidence, I think our environment is one that promotes self-confidence. All of our kids are very accepting, and it's a relaxed environment in the sense that everyone feels like they belong, and as they should. So I think for us, it's not all about the athletics piece. We have a fair amount of kids. I can think of one in general who was really looking to gain confidence and to lose a little bit of weight, and to see the change in personality, over the the first 2 to 3 months and then moving forward was very gratifying for us as a staff. So yeah, it does not have to be athletically driven by any means.
Do you offer the same services in Saco and Sanford?
Yes, we do. We do offer the same services. I think it's having 2 locations is great. And if you were to see our Saco versus our Sanford location, they're pretty much the same. We wanted to have that same feel as you walked into each facility, as far as equipment, setup, care, services that you would get. We want it to be seamless.
So, Mike, does the Sports Performance Center offer any new state-of-the-art services that you'd like to tell our listeners about?
Yeah, we were very fortunate. About 2 years ago, we started to research for knee arthrometers, which is measuring translation, pretty much keeping the ACL in check and being able to assist diagnosing partial ACL tears versus complete ACL tears versus no ACL tear. And we had a great success story. About a year ago, we were the first hospital in the United States to be able to offer what we call a GNRB, which is the brand new, very reliable knee arthrometer device. We had a physician actually at Southern Maine Healthcare who she had tore her ACL playing tennis. And the last thing a physician wants to hear is that she, being in her mid-40s, was going to need ACL reconstruction and miss a lot of work. And having 3 kids at home, just ACL surgery was not going to fit. When we did our clinical exam, both myself and Dr. Dollard felt that her ACL really wasn't all that bad, and we were both kind of surprised looking at her MRI. So we did a GNRB on her, and we were able to pretty much say that our clinical exam went right along with the computer exam that we were able to do on her knee. We did some physical therapy, and then she transitioned into sports performance with Rick. And now it's been over a year. She's back playing tennis, doing everything, and she was able to avoid an ACL reconstruction, which would have taken her out of work, which would have caused her a lot of lost time, a lot of lost revenue. And she's much happier now. And she said, my knee doesn't bother me at all. And I'm very happy that just, based on an MRI, it said I needed surgery. But based on the testing you and Peter Dollard were able to do, I was able to avoid a surgery. And she's very appreciative for that. The other thing that we're able to offer is we're one of the few places in the state of Maine that has an optojump, which is measuring force production, power, as well as be able to get video on kids with their movement patterns. And the one thing that Rick and I have started to do is we're starting to test our ACLs to see if there is a discrepancy at 6 months. We just recently had a Biddeford basketball player who he had hit his quote-unquote 6-month clear. However, once we did the optojump on him, we realized that he was still significantly favoring one side versus the other. Compliance was a big issue with this athlete as well, we'll say that. However, he was able to really come in for a month, hammer with us, be able to get his strength back. We did the optojump test again, and we looked at it, and he was actually only about a 5% deficit from one side to the other, which both Rick and I felt was okay to send him back to the basketball court. Now, about once a week, you pick up the paper and you're seeing his name for being the leading scorer for Biddeford basketball, who's having a great season this year. So those are some of the success stories where, just because the athlete hits 6 months doesn't mean that they're ready to go back on the court, ready to go back on the field. We want to make sure that, like we said earlier, we're getting these athletes back safely, so we have these tools to be able to utilize.
And I think just to add a little bit, with our OptoJump product, that's something that we're using for a lot of our initial evaluations too with our population on the strength and conditioning side. It allows us to see a lot of different things that allow us to put together a unique program. So I can think of a case in particular where I just used it a couple of months ago on a kid who had no history of any injury, but went through the OptoJump, and we saw that force production and ground contact time and power was significantly different from side to side. And I asked the kid, I said, geez, had you ever hurt yourself? And he said, no, nothing I can think of. And then come to find out, about 3 years earlier, he had hurt his right knee and didn't remember, had never been an issue. And we're talking, 25 to 30% deficits from side to side. So you're able to develop a program that addresses these concerns. And then on retest, you look at it and things are back to normal. It gives us a checks and balance on, is our programming working, which I think is very important as well. You can say you do a lot of things with your program, but this gives objective data to prove that it is working. So I think that's been a great product for us overall.
Well, it's been great talking to both of you. If someone's listening to this and they want to access some of the services that you offer, what's the easiest way for them to do that?
So they can either go to the website, www.smhc.org/sports, and contact us through there, or they can call 207-294-8448 to get in touch with our Saco office, or they can call our Sanford office at 207-490-7700 to get in contact with our Sanford office. Another thing that we do very well and happens all the time is people just walk into our facilities, either at 1 Emile Lavasser Drive in Sanford or at 12 Thornton Avenue in Saco. Just walk on in, ask for Mike or Rick, and we'll be able to give you a tour of the facility and show you why we are a little bit unique in the area.
Well, Mike and Ricky, thanks for talking with us. It's been great to have you on the show today.
Thank you very much, Robert. It was great being here.
Thanks again for having us.
You've been listening to Medically Speaking. I'm your host, Robert Erickson. Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.